On November 9, 2015, the PaTH Clinical Data Research Network convened a meeting. Researchers, physicians, health system and health plan leaders, and patients from 6 healthcare systems came together in Pittsburgh, Pennsylvania to have a conversation. We had been charged by our funder, the Patient-Centered Outcomes Research Institute, to work with health system leaders to identify and prioritize research activities of high interest to health systems and clinicians, which could be addressed in PCORnet. Patients and healthcare providers needed to be meaningfully involved in the discussion and vetting of topics. PaTH collaborated with a team of facilitators who have expertise in communication and public deliberation. They helped to craft an agenda fostering productive conversation among individuals with diverse backgrounds, vocabularies, and prior experiences with healthcare. We decided to start the day with our patient partners sharing their experiences in healthcare. With a real-time conversation, we hoped that participants could learn together by listening and responding to each other. But none of us were sure how this conversation would work. Some of us were quite anxious. And here is what happened. People talked, they listened, they relaxed and thought and built on each other's ideas. We brainstormed about different topics' merits and drawbacks, and which ones would best take advantage of the strengths of PCORnet data. In our pre-meeting polling and at the beginning of the day, the patients, clinicians, and healthcare leaders favored very different research areas. By the final vote, though, a single topic dominated: the idea of studying high utilizers of healthcare. This topic can be addressed in a 1-year time frame. It can leverage the unique CDRN data, since the population is large enough to allow us to study patterns of care use among patients with specific health problems. And the longitudinal nature of CDRN data can allow us to examine patterns over time, to see how people get into the position of needing to use the healthcare system frequently, so that perhaps we can develop interventions to prevent high utilization, rather than intervening only once there is a problem. Our group ended the day with a sense of community and one of accomplishment, as well as hope that our work will result in knowledge that can improve the way that care is delivered. PaTH will send delegates to discuss our findings at a meeting sponsored by PCORI and the National Academy of Medicine in January 2016. We look forward to sharing our insights from this project and learning about other networks' experiences in engaging these stakeholder groups. We hope that we may be able to answer the questions that our stakeholders raised and endorsed, and that the day will result in long-term collaborations with the amazing group of individuals who have shared their perspectives with PaTH.